In the following sequences, we will show you how to use the Pari Boy Sx and to carry out the cleaning procedure. Please ensure you read the instructions for use. Your doctor has instructed you to use a Pari Boy Sx. In this video, we would like to show you how to use the Pari Boy Sx correctly and provide you with valuable tips on handling and cleaning your nebulizer system. The Pari Boy Sx comes with a wide range of extra equipment: a child mask, LC interrupter for intermittent nebulizing, and in addition to the blue one, a red nozzle attachment. With the blue nozzle attachment, the particle size in the aerosol is specifically designed to provide effective, rapid delivery of medication to the central region of the lung. The red nozzle attachment creates an extremely fine droplet spectrum that is ideal for delivering medication to the peripheral area of the lung. The LC SPRINT Nebuliser is also equipped with the PIF Control, a working part in the nebulizer upper section that limits inhalatory flow and so teaches the user to breathe in slowly and deeply. But how does inhalation actually work with a PariJet nebulizer? The liquid added to the nebulizer is drawn in by the compressor airflow and atomized at the nozzle to form fine droplets. This produces an aerosol. The aerosol is then inhaled via the mouthpiece or mask. The inspiratory valve opens on inhalation, and production of the aerosol is supported by the supply of air from above. This means more aerosol is extracted from the nebulizer, so shortening the nebulization time. Taking deep, slow breaths ensures optimum transport of the aerosol to the lung. The inspiratory valve then closes again on exhalation. The expiratory valve opens simultaneously, so this is the only way for the aerosol to escape. This valve system, used in the nebulizers of the Pari LC SPRINT family, ensures economical usage of the medication. The droplets produced vary in size depending on the design of the nozzle attachment. The size of the particles determines which part of the lung is reached by the aerosol. This ensures that it targets the exact place where its effect is required. This is why Pari has developed 3 nozzle attachments, each being designed with the patient's age or the application in mind. The blue nozzle attachment is especially suitable for targeting the middle of the lung in patients from around the age of 4 years and upwards. The yellow attachment produces fine droplets for the narrow airways of babies and infants and forms part of the LC SPRINT Junior Nebulizer. The red attachment results in a very fine aerosol. This is ideal for treating the outer lung regions, as required for COPD, for instance, or for the tiny structures of the lungs of newborn babies. Please wash your hands first, because even healthy people have microorganisms such as bacteria on their skin. Before starting a nebulizing session, the compressor should be placed on a firm, dust-free surface, ideally a table. To assemble the nebulizer, first push the nozzle attachment onto the nozzle in the nebulizer lower section. Screw the nebulizer upper section onto the nebulizer lower section. Now attach the mouthpiece to the nebulizer upper section. Use the connection tubing to connect the nebulizer to the compressor. Open the cap on the nebulizer upper section. Fill the nebulizer chamber with inhalation solution from above. Do not fill past the maximum fill level. This is equivalent to about 8 milliliters. Sit in an upright position and relax. Close the cap on the nebulizer upper section, hold the mouthpiece between your teeth and enclose it with your lips. Switch the appliance on. Breathe in and out through the mouthpiece as slowly and deeply as possible. The exhaled air should escape through the expiratory valve in the mouthpiece. If you notice a resistance, it is a sign that you should slow down inhalation. This is due to the PIF Control System, which closes up the inspiratory valve until only a small opening is left. please continue by inhaling more slowly. The LC interrupter can be used to switch the LC SPRINT Nebuliser from continuous to intermittent nebulizing. The interrupter is pushed up into the nebulizer from below and attached to the connection tubing. Inhalation follows the scheme: press when inhaling, aerosol will be produced. Release when exhaling, the production of aerosol stops. This inhalation method is highly economical in terms of medication. The interrupter can be switched from intermittent back to continuous nebulizing by turning the button clockwise. Repeat this inhalation procedure until the noise made by the nebulizer changes, indicating that the inhalation session is complete. Then check whether a clearly visible aerosol is still flowing from the nebulizer. Stop treatment as soon as the aerosol emerges intermittently. Any moisture that appears in the connection tubing can be dried by using the compressor to blow air through the tubing for a few minutes. For cleaning and disinfecting, disassemble the nebulizer completely into its individual parts. We recommend that you clean the nebulizer parts thoroughly for about 5 minutes with warm tap water and a little dishwashing liquid. Then rinse all parts thoroughly in warm, running water. Alternatively, you can also clean the nebulizer in your dishwasher. Disinfect the nebulizer components either in a disinfector or by placing them in boiling water for at least 15 minutes. Between uses, wrap the nebulizer in a clean, lint-free cloth and keep it in a dry, dust-free place. The Pari PEP S system is also available as an optional accessory. It is used to mobilize secretions in the lower respiratory tract. When using the PEP system, the user breathes out against resistance. This prevents the respiratory tract from collapsing. This in turn makes it easier to expectorate and to exhale more air. PEP treatment may be performed separately or at the same time as nebulization treatment in order to save time. In addition to the child mask, an adult mask is also available as an option. Press the mask gently but firmly over the mouth and nose and breathe in and then out again through the mask, as described for the mouthpiece.